Hi, Dr. Fisher here, and this is another one of our frequently asked questions in our series of frequently asked questions. This is a great question. I get this periodically where people are asking, once you start using Fisher traction, do you need to see your chiropractor anymore? Or do you need to see your therapist anymore? And how I always answer that is without a doubt, if you're already having success through your adjustments and through your therapy, that you want to keep those successful actions going. Fisher traction is by no means is it a tool to eliminate or circumvent or get rid of the need for chiropractic care or any other type of physical therapy or physical medicine. Fisher traction really is more of kind of bridging the gap between your treatments, especially from the chiropractic side. Chiropractic is more than just the stretching of the spine. Chiropractic, to me and to most chiropractors, we're attempting to correct structural problems and help to prevent things like scoliosis from getting worse. Fisher traction, as much as it can pull and decompress the discs and help eliminate pressure on the spine and your spinal nerve roots, it doesn't correct or fix curves that are not supposed to be there. So obviously you still are going to need somebody to push on these curves, these abnormal curves, to try and get you straighter and straighter. So Fisher traction is really, really successful in all the years that I've been using it when my patients are doing both. This can be used as maintenance, as like I said, bridging the gap in between our adjustments and the correction. Because chiropractic, not only are we increasing the range of motion of the spine, we're trying to correct abnormalities or abnormal position of the bones. Okay, well, in between, like I use this a lot in my office, where my patients will go down on Fisher traction first, whether it's the neck or the low back, and they experience some decompression and some relief. So then when I adjust them, my adjustments go so much easier. And then I tell them, like, hey, if you're coming in, once a week or once every 2 weeks or once a month, make sure you're using your Fisher traction in between to keep that momentum going on, or the maintenance and control, where ultimately we want you to have the control over your spinal issues and not have to rely on us 100% all the time. Okay? Now, for treatment, most chiropractors follow a certain treatment plan where in the beginning you might have some intensive treatments where you're coming in more frequently to help alleviate any of your symptoms and your acute issues. And then as time goes on, you're starting to decrease the frequency of your treatments as you're improving and structurally improving, your ranges of motion are getting better. And then finally, you get to a certain point where you're pretty much either at your pre-complaint status or you're corrected. And then from here, you use maintenance. It's almost like if you think of us chiropractors as like an orthodontist, and it's our job to try and correct the alignment of your spine like you're trying to correct the alignment of your teeth. Then once we get you to a point where we're able to release you from care, you're into maintenance care, it's like the retainer, like you wear at night. So it helps to prevent your teeth from shifting back. Well, this retainer or maintenance phase, this is exactly where Fisher traction can come into play, where you're always trying to keep the motion and your discs hydrated, so you're never falling back, because you may not be able to see your chiropractor all the time. So definitely, it's not a substitute for getting adjusted, because it doesn't accomplish the same things. You need them both. And it's the same thing with therapy also. With physical therapy, you have a rehabilitation phase where you're strengthening and conditioning your muscles around the areas that may have been injured. You still need to do those too. You still need to stretch, you still need to work out and exercise. But this, can maybe take the edge off of some of the complaints that you have periodically, but for sure, this helps in the maintenance and prevention and keeping your discs in your spine healthy, okay? But it's not any substitute for adjustments in therapy. And also too, understand that like any treatment, if you started with Fisher traction by itself and you go for 30 days and you're not improving, you're not getting better, or you're getting worse, then you have to discontinue this alone. Go see your doctor, get his clinical opinion of what might be going on with you. The protocol that I use in my office and have for years with not only with Fisher traction, but any of the therapies and treatment that I do, is that if I have a patient and they're coming in consistently with Fisher traction, if they're using it every day for 30 days, if after 30 days you're not any better at all, or if you are worse, I'm gonna refer you out to see another healthcare professional. Typically, I'm gonna refer you out to see an orthopedist or a neurologist, maybe get an MRI to see if there's some other underlying issue that we just can't see from x-rays or your basic physical examination. So, if this is working and your momentum is going forward in a positive direction, awesome, keep using it. Keep using any other techniques or treatments that are successful for you. But if you do stall out and you are stalled out over a month's time, then you need to go seek the advice or a second opinion of somebody else and probably get an MRI, okay? So anyways, yeah, Fisher traction is not something that you should only use without seeing your chiropractor, your physical therapist. You use it in conjunction with, or if it's working on its own, then hey, you're good, right?